Hello, this is Carolina again. I'll be guiding you through the next microbiology section, which is called the systems, in which we'll mostly be synthesizing and reviewing information about bacteriology, virology, mycology, and parasitology. If you haven't studied these topics yet, it might be worth reviewing those now. We'll start by looking at the normal flora. Our skin is covered in bugs. Staph epidermidis is normal flora of the skin as well as the nose. The nose also contains Staph aureus. Here is an image of Staph epi gram stain. Realize that being colonized by these bacteria is not the same as being infected. Do you understand what I mean by that statement? Briefly, the bugs may be living in your nose and your skin, but they are not actively causing infection. Trouble occurs when, for instance, the Staph epi in your skin gets into your blood, such as during surgery. This can cause fever, an increased white blood cell count, and other manifestations of sepsis. The oropharynx contains viridins group strep, and dental plaque often contains strep mutans. You might see a question about a patient getting a dental procedure and then manifesting a fever and possibly a new heart murmur. This is how they would test your knowledge of endocarditis. Here is a pathology specimen showing a patient's heart that had bacterial endocarditis, which involved the mitral valve. In this specimen, the left ventricle of the heart has been opened to show the mitral valve fibrin vegetations due to infection. Some patients are more susceptible to getting endocarditis and actually need antibiotic prophylaxis before undergoing dental treatment. The recommendations for these patients who need antibiotic prophylaxis has actually changed in recent years, and if you ever need to make a decision on the wards about antibiotic endocarditis prophylaxis, you will need to look up the most recent guidelines. Take a look at cardiology for more information on endocarditis if you are feeling shaky. In the colon, there is Bacteroides fragilis, the medically most important anaerobe, and E. coli, the most important facultative anaerobe. They are both normal flora, although the number of Bacteroides is much more than the number of E. coli. Lastly, in the vagina, Lactobacillus is normal flora. It can also be colonized by E. coli and group B strep. GBS is a common pathogen that obstetricians check for in the vagina of pregnant women before they deliver their babies and treat it if they find that they are GBS positive, aka colonized by GBS. Realize though that prepubertal and postmenopausal women will have normal skin flora such as Staph epi in their vaginas. Speaking of babies, it's important to keep in mind that neonates who are delivered by C-section have no flora since they have not acquired all the bacteria from the vaginal canal, but are rapidly colonized after birth. There are several bugs that can cause food poisoning. The time of onset of food poisoning and the food a person eats are high-yield clues to diagnosing the bug. For the boards, knowing the food is often the key to answering this type of question. Before I go through the list, there are two bugs that cause rapid onset vomiting and diarrhea with roughly less than a 6-hour incubation period. As quick as they are common, they also resolve quickly. They are Staph aureus and Bacillus cereus. The reason for this is that the preformed toxin is ingested. Do you think antibiotics would help in this case? Correct, they would not. A patient who has eaten reheated rice may be infected with Bacillus cereus. Be serious about Chinese food to remember this. Anytime you see mention of canned foods or honey, your first thought should be C. botulinum. You can see the dents in these cans, which should raise concern for botulinum. Do you know why these bulges exist? It's because the bacteria release various gases as products from digestive processes, which manifest as these dents and bulges in the cans. In the case of C. botulinum, do you remember what causes the disease in A. adults and B. kids? Yes, you're right. In both adults and kids, it is ultimately the toxin that causes paralysis. In babies, however, they ingest the spores first, that then germinate into bacteria and release the toxin. The reason for this difference is thought to be the young age and consequent lack of protective bowel bacteria. I swear that I am not trying to make you hungry on purpose. Reheated meat dishes and meat pies can contain Clostridium perfringens. Undercooked meat can be responsible for E. coli 0157H7 infection, which is enterohemorrhagic E. coli. Undercooked poultry, meat, or eggs can all cause salmonella. Patients who have recently eaten meats, mayonnaise, or custard may be infected with Staph aureus. Patients who get food poisoning from contaminated seafood are often infected with Vibrio parahemolyticus or Vibrio vulnificus. There's one more food association we've mentioned before that is worth remembering. Do you recall what unpasteurized cheese is associated with? It's Listeria. Remember that this is a particular concern in pregnancy and is why pregnant women should avoid unpasteurized cheese. Okay, now we'll talk about some bugs that can cause diarrhea. The first important distinguishing factor is whether the diarrhea is bloody or non-bloody. This is an important clue which you'll see in the question stem and can help you narrow down the organism on the boards. First, starting with the bloody diarrheas. Campylobacter is a gram-negative, comma-shaped organism which is unique in that it grows best at 42 degrees Celsius. Remember the mnemonic, Campylobacter likes a campfire. It's a major cause of foodborne illness and can be obtained through animal products as well as domestic animals, including dogs, cattle, and chickens. Can you remember which neurologic disease can be caused by Campylobacter jejuni? That will be Guillain-Barré syndrome. Our next bug that causes bloody diarrhea is Entamoeba histolytica, which is a protozoan that can cause flask-shaped ulcers in the intestinal mucosa. Enterohemorrhagic E. coli, or E. coli 0157H7, also causes bloody diarrhea, and similar to Shigella, produces a sugar-like toxin. Do you remember how the sugar and sugar-like toxins work? Right, it is by cleaving rRNA with 50S ribosome inactivation. Enteroinvasive E. coli, as its name suggests, invades the colon and can cause dysentery, which includes bloody diarrhea. This is due to its causing necrosis and inflammation of the colonic mucosa. It does produce a toxin. Salmonella can also cause bloody diarrhea, as can Shigella. Shigella, however, is the main cause of bacillary dysentery. Keep in mind that Shigella has a very low ID50, which means that very few microorganisms are required to cause an infection. Also keep in mind that Shigella does not have an animal reservoir, unlike Salmonella, which does. Our last bug, Yersinia enterocolitica, is a common cause of bloody diarrhea in daycare. Remember that it has a heat-stable toxin similar to the one seen in E-tech. Yersinia is the most common bacterial cause of an appendicitis mimicker. Mesenteric adenitis is seen in children and is worrisome because it can imitate the lower right quadrant pain of appendicitis. Adenitis is simply inflammation of the lymph nodes, and these bacteria irritate the lymph nodes of the ileum. Let's move on to watery diarrheas. The first bug on the list, C. diff, can actually cause both watery and bloody diarrheas. It can also cause pseudomembranous colitis as well. C. perfringens, which can also cause gas gangrene, is another cause of watery diarrhea. Enterotoxigenic E. coli, or E-tech, causes traveler's diarrhea and produces ST and LT toxins. How do these work? Let's refresh your memory. In the case of ST toxin, it increases cGMP levels by overactivating guanylate cyclase. In the case of LT toxin, it increases cAMP levels by overactivating adenylate cyclase. In your mind, link E-tech's LT toxin with Vibrio cholera and E-tech's ST toxin with Yersinia. Remembering LT toxin and Vibrio cholera toxin is probably more high yield comparatively. Finally, other causes of watery diarrhea include several protozoa, including Giardia and Cryptosporidium. Vibrio cholera, which commonly causes outbreaks in third world countries and is known for causing rice water diarrhea. People used to die from cholera, the main cause being dehydration from massive loss of water and electrolytes in the diarrhea. This was until someone figured out a simple way to treat people, oral rehydration solution. Review this in gastrointestinal, because cholera is a favorite on the boards. I think every single one of us has gotten at least one question on cholera on the boards. Lastly, several viruses, including rotavirus, adenovirus, and norovirus, can cause watery diarrhea. Pneumonia is an infection of the lung parenchyma, the main substance of the lung. Several different microorganisms can cause pneumonia, and by knowing which ones are most likely to infect people of which age group, you can more easily figure out which bug is infecting your patient. In the pulmonary section, you'll learn more about the different types of pneumonia. Let's go through this table that summarizes the main causes of pneumonia. If you see pneumonia in a neonate, it's most likely caused by group B strep or E. coli. Remember B, as in group B strep, is for babies. We just mentioned GBS as a colonizer of the vagina. Now, does it make sense to you why we check women for GBS before they deliver their baby? Right, we want to prevent pneumonia in neonates. Children from age 4 weeks to 18 years are much more likely to get pneumonia from viruses, such as respiratory syncytial virus. Remember that this virus infects even when maternal antibodies are still present in the infant. The common bacteria include Mycoplasma, Chlamydia trachomatis in infants, Chlamydia pneumonia in teenagers, and Streptococcus pneumonia. As I mentioned earlier, almost all children will be infected with RSV at some point in their life. To remember the sources of pneumonia that most commonly affect children, you can use the mnemonic runts make cough chunky sputum. Pneumonia in adults is often due to similar organisms as pneumonia in children, including Mycoplasma, Chlamydia pneumonia, and Strep pneumonia. The only difference really is that adults aren't likely to get it from RSV. Older adults above the age of 40 can also get pneumonia from Strep pneumonia and Mycoplasma, but are now also likely to get it from Haemophilus influenza, aka H-flu, anaerobes, and some viruses. Finally, in the elderly, the most common sources are strep pneumonia, influenza, anaerobes, Haemophilus, and some gram-negative rods. In addition to thinking of causes by age, we can also categorize pneumonia by how it's obtained. What is the most common source of pneumonia in alcoholics? It's still strep pneum. Pneumonia seen in alcoholics or IV drug users is often due to strep pneumonia, Klebsiella, or Staphylococcus. Pneumonia caused by aspiration is often due to anaerobes. Lastly, Mycoplasma, Legionella, and Chlamydia can all cause atypical pneumonia, which is also known as walking pneumonia. It is a type of pneumonia in which chest X-ray will often be positive before symptoms even start to occur. With walking pneumonia, the X-ray often looks worse than the patient's clinical presentation. Patients with cystic fibrosis are most likely to get pneumonia from Pseudomonas, Staph aureus, and Strep pneumo. Pneumonia in immunocompromised individuals can be caused by Staph aureus, enterogram-negative rods, and also fungi, viruses, and Pneumocystis jirovecii, which is most common with HIV. What is the most common cause of pneumonia in these immunocompromised patients? This is a great trick question. Remember that strep pneum is one of the most common bugs causing pneumonia, and if no clues are given to point to an atypical cause, your answer should be strep pneum. This is a favorite question. Hospital-acquired pneumonia is often from Staphylococcus aureus, Pseudomonas, or other enteric gram-negative rods. Patients with recent viral infections can often get pneumonia from Staphylococcus or Haemophilus. This is known as secondary pneumonia, where the bacterial pneumonia is superimposed on the viral pneumonia. Let's do a flash quiz. The most common cause of pneumonia in neonates is what? While the most common cause of pneumonia in all adults is which bug? The most common cause of pneumonia in an HIV-positive patient is what? Okay, so the most common cause of pneumonia in neonates is GBS, while the most common cause of pneumonia in all adults is strep pneumo. The most common cause of pneumonia in an HIV-positive patient is still strep pneumo.